We'll start with the portion, 4-ounce portion, which is the size of the sleeve gastrectomy stomach and the duodenal switch. The gastric bypass is just a tad smaller. It's 3 ounces rather than 4 for the gastric bypass. But this 4 ounces is the same as a half cup measuring cup, and the 3 ounces for the gastric bypass is the same as like a third. So they can use this instead of a scale when they're putting their food together. And what I have here is a sample smaller salad, sandwich, dessert-sized plate or a kid's plate, where half of the plate would be 1 ounce of protein or 1.5 for the gastric bypass. For the sleeve, who can have 4, and the DS, who can have 4, it would maybe be 2 of these, plus a quarter cup of a low starchy vegetable. And if any of the patients want a carb choice, which are the starchy vegetables, mashed potatoes, sweet potato, peas, corn, yuca, plantains, fruit, any kind of fruit, as well as bread or cracker, cereals, it would only be a tablespoon or 2. So we also tell them to get the tablespoon measures too to help them. Post-procedure, we go over how to increase their protein. First, they'll need to use the protein shakes as their stomach size, the surgery heals, and then we gradually add back more protein in food sources, anything from animal or plant-based protein. So that includes like milk, yogurt, cheeses, beans, lentils, hummus, peanut butter, even a lower fat, lower sugar type, as well as continuing to add the protein as needed. The best ways to hydrate are really to drink water or fluids. So we try to tell them to sip, sip, sip all day long. Take a sip or 2 or 3, about 1 ounce, every 10 to 15 minutes the first 3 days after surgery. Then after that, we tell them to always take water or fluids with them when they leave home. But the best way to hydrate is to drink.